Hello everyone, welcome back to our channel. Today we will discuss about why laboratory diagnosis is important. Though there have lots of reasons beside this one, lab diagnosis is important. But when I am asking any kinds of questions to the lab technology student, they are not able to understand to giving the proper answer. Why lab diagnosis is important? I am providing you one example. Hopefully, you will enjoy the whole video. Then you can easily understand as well as you can easily give to the questioners or who will ask you the question, you can easily give answer. So that please listen it properly. For giving the answer, why lab diagnosis? Why? Why? For giving the answer, here I have taken three diseases. The three all are fever. All are same disease, that is fever. Fever is same, but their symptoms is different fever. So that you need to understand, is it malaria? Is it dengue? Is it typhoid? Just listen me properly. Firstly, I am coming from malaria. Malaria is a disease which is caused by parasite, right? Parasite. And the causative agent is mosquito, M4 mosquito. And dengue, it is also fever, but the causative agent is virus, right? If I am coming to the malaria, the causative agent is Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, Plasmodium knowlesi, and Plasmodium malariae. So there are five causative agents in malaria. They all are parasite in nature. It's also microorganism, organisms, parasite. We cannot see into our naked eye. After that, if I am coming, that is dengue, that is virus, and causative agent is dengue virus. Dengue virus. See, that is also microorganism. We cannot see into our naked eye, right? Last one is the typhoid. It is also one type of fever that is caused by bacteria, right? Bacteria. What are the causative agents? Salmonella, Salmonella typhi, and Salmonella paratyphi. Yes or no? See, so that if you are noticing the things, they all are the same fever, but the causative agent is different. If you are noticing the malaria, the causative agent is parasite. If you are noticing the dengue, the causative agent is virus. If you are noticing the typhoid, the causative agent is bacteria. So that if you are properly diagnosing these things, firstly you need to understand the what is the fever. Is it dengue? Is it malaria? Or is it typhoid? Firstly you need to understand these things, because see, if I am erasing this part so that you have understood this part, I think that the all positive agent is different. In the malaria, that is parasitic fever. In the dengue, that is viral fever. In the typhoid, that is bacterial fever. So that I am erasing this part. Just listen it properly and just watch the video. See, if the parasite, if parasite is attack, or if the microorganism is parasite, you cannot give antibiotic. There have some misconception to the everyone. Any kinds of fever or any kinds of disease, firstly we are providing the antibiotic, but not there. Antibiotic is a different things. Antibiotic for defense the bacteria, or for protect the bacteria, for kill the bacteria, not parasite. So that if the malaria if the malaria fever is occurred, who do will diagnosis? So that doctor will prescribe that. If the patient is suffering fever, doctor will prescribe that test. Doctor will prescribe malaria, doctor will prescribe doctor will prescribe dengue, doctor will prescribe also typhoid. Doctor in the single time cannot prescribe these three things, but sometimes they are prescribed. But doctor can prescribe any one test, or three might be within a same time. So that after that, that is the patient, right? Doctor was into the patient, doctor are prescribed these things. After that, the patient are holding this prescription, and the patient are coming to the lab technologist. or to the laboratory professionals. The patient will come. After that, they will provide you, or lab professionals or lab technologists will provide you, is it dengue, is it malaria, or is it typhoid, is it typhoid, so that there should be only one. Understood? After that, the patient will go to the doctor again. The patient are coming to the doctor again, and doctor will diagnosis. Diagnosis is already complete, and doctor will prescribe the patient. If it is malaria, then the anti parasitic drug, anti parasitic drug. If it's dengue, then antiviral drug, right? Or if it's typhoid, then that is antibiotic, right? See, if you are noticing the things, that was the causative agent and that was the treatment part as well as the drug. There is a different drug for inhibiting or for destroying the different microorganisms. Please keep in mind that not every fever or not every disease you are providing the antibiotic. That is not right. You need to understand what are the fever is. So that if you are understanding these things, or if you want to diagnose these things, what is the real fever, then you have to come to the technologist. You have to come to the lab. And who will present it to the laboratory? Lab technologist, who will perform the test. So that until or unless these steps are coming, you cannot go to the doctor, or doctor cannot prescribe the drug. If it's malaria, then anti-parasitic drug they will prescribe, antiviral drug if it's dengue, or antibiotic if it's typhoid. There have also lots of examples, but I like this example so that I am evaluate in front of you this example. See, so that this step is important. Please keep in mind that these steps are occurring into laboratory. Who will do? You guys will do. M.T, medical technologist or medical laboratory technologist, you guys will do these things. And so please keep in mind that without you guys, the diagnosis will not happen. And without diagnosis, the doctor can't prescribe the right disease, right treatment, or right drug. So that you are important, so that your profession is important, so that your understanding is important, your diagnosis is important. Please keep in mind that. Hopefully you have enjoyed the whole video. Thank you so much for watching. Stay tuned with us. Thanks a lot for listening.